welcome to this week's video podcast. I'm Brent Dodge, owner of Alpine Physical Therapy. This week we're going to be looking at the topic, the upper chain. And we're going to define that in just a little bit. And I've got with me Kerri Houck, physical therapist here at Alpine, to talk about her background as a physical therapist and a sports medicine resident, and what that means in terms of looking at the upper chain and evaluation and treatment, and how that applies to our overhand athletes. Kerri, we're glad you're here.
Thanks for having me, Brent.
I think it'd be great if you could share with the audience, your background as a physical therapist, and then specifically kind of your work in the world of a sports medicine resident.
Okay. I graduated from PT school from Northern Arizona and had the opportunity to go to Wisconsin, La Crosse, Wisconsin, to do a sports residency, which is one of the oldest sports residencies in the nation. And there I had the opportunity to work with all different mentors, many specialists in different fields, ranging from runners to shoulders to all different pathologies. And then with that, we got to do event coverage, so I was able to work with athletic trainers and go to the training room, work one-on-one with the athletes in that setting, and then do event coverage. We also worked real close with our orthopedic surgeons there, doing a lot of post-op rehabilitation, and then we had the opportunity to do a lot of continuing education. One of my last continuing eds was down in Alabama, which for overhead athletes, that'll kind of ring a bell with Dr. Andrews, Dr. Glenn Feisig, and Kevin Wilkes, some of the leaders in the field with overhead athletes, specifically baseball. But what it really got me interested in was in the upper chain and treating those athletes, because it really it's for everyone. Those concepts are similar, even if you're playing tennis, if you're golfing, even getting anything when we're getting our arms overhead. It really got me interested in that.
You mentioned the upper chain. Tell us what that is. Talk to us about the upper chain.
So the upper chain is interesting because whenever anyone comes in, they think, I have a shoulder injury, and so they expect the PT is going to look just at their shoulder. But when if someone tells me they have a shoulder injury, I think the upper chain. So I'm going to start at the hips. The hips, the trunk, the scapula is super important, so that shoulder blade, how it's moving, the strength. And then translate distally. So we're going to start proximal and move down distally all the way to the hand, down to the elbow and wrist. So that's what I consider the upper chain.
So in treatment, how does that affect the way that you look at a person from maybe the first visit and into some treatments that you might do with them if they're there for, like, say, a shoulder
Right, so if
problem.
they come in and they have an acute injury, a shoulder injury, so of course I'm going to look at that first, and we want to decrease those symptoms. If they have pain, inflammation, and I'm going to get hands-on if I can, do some manual therapy, maybe do some taping, and just do some things to decrease that pain. But that's a great time for us to look at the upper chain. We're going to look at the neck, we're going to look at the scapula, we're going to look at the thoracic spine, and then on down to the hips. A good example of this is pitchers. They come in and they're having, say, elbow pain, right? So they have this acute elbow pain. So we want to calm that irritant down, calm those symptoms down, and then that's a time I'm going to start looking, what's their thoracic extension, what's their thoracic rotation, because pitchers, they've got to get back far. But if they don't have this motion in their core and their trunk, are they compensating with their elbow, right? So that's a good time, right when they come in, we start looking at those other issues that may be playing into their elbow or shoulder problems.
So I think of that chain, like when you mention chain, I almost think like a bicycle chain where there's these links, and if you don't take all those links into consideration, you're going to probably miss what needs to happen.
Right, and you're going to be in 2 or 3 more months to see me again, right? Because we didn't really get to the base of the problem. Because you may be having elbow symptoms because you don't have that thoracic extension, the thoracic rotation, or your scapula is not strong enough. And a lot of times with elbows, it's a shoulder problem. Your external rotator, so the muscles in the back of your shoulder aren't as strong as the front muscles, say. So we look at that ratio, and if all I did was do a little, treat those acute symptoms of your elbow, you're going to be back in, right? Because we got to take away the problem. And for the elbow, it might be some wrist, some hand issues too. So it's, we got to treat the whole chain, right, in order to get you back to those activities. And it doesn't have to be sports. It can be, you can be a construction worker and you're hammering overhead, right? So all of that stuff, you just got to take that into account. So it's treating the whole chain, not just that extremity or that joint.
Well, it's interesting you mentioned elbow pain, because I've worked with several other physical therapists that have sport backgrounds, and I was dealing with some elbow pain and working locally, and immediately when one of our sport therapists looked at me, she started looking at my shoulder blade, and intuitively I should have known that, but she went after it.
Right.
And it made all the difference. Just some treatment locally or to my shoulder and my scapula helped my elbow. So I can see what you mean by treating the link.
Definitely, and I mean our bodies they're amazing at compensating, right? They're gonna, if you don't have the shoulder, they're gonna really try and get some of that strength, some of that torque from your elbow, but it's just, eventually it's gonna fail, it's gonna fatigue, and if you don't have that base, and it really, like I said, it starts at the hip, it starts at the core strength. If you don't have that, eventually you're just gonna be back in with the same problem.
Well, clearly, with your resident background, you covered the spectrum of sport and the relationship of physical therapy and sport. But it sounds like you've really taken an interest in the upper chain and working with overhand athletes. And I think with all that's going on in Missoula, that makes sense, with all the way from tennis and baseball players and other throwing sports. Tell me a little bit about that.
Well, I think it's just it's exciting, and it's complicated. It's like a big puzzle. You get these athletes in that, you know, anytime they're going overhead, they're going backwards, that they're getting this pain. And it's exciting because there can be a lot of different things going on, so it's that puzzle trying to figure out where are they lacking. So it's almost looking at the sport-specific or that activity-specific activity and seeing where they're having pain and then breaking it down, so working backwards. Another thing too, which I love, is the dynamic stability. That shoulder is especially super mobile. We get it overhead and we're asking it to do all these things that are super hard on the shoulder, and if we don't have that strong base and that dynamic stability, your brain telling that shoulder to be stable overhead, then we run into problems. That's where we get pain, and that's where, I mean, volleyball, any of those sports are asking you to be really strong in that position. It's hard.
Those concepts that you just talked about, the brain connecting, you know, and activating what's going on in the shoulder blade and the upper extremity, it applies across the board. I mean, all these different athletes, and even you mentioned industrial athletes, workers that might be working overhead and that kind of thing.
And it can be as simple as someone like emptying a dishwasher. I mean, think of how many times a day we're moving our arm overhead, and if we can't control our arm in space, then we're going to have pain. You know, eventually something's going to break down. So I think that's one of my favorite parts about the shoulder, is the dynamic stability, and starting from the core down and controlling that.
I think it's super exciting that in Missoula we have therapists like you that have gone, not only have you gotten your doctorate in physical therapy, as you mentioned, but have gone on to do a resident program, in this case a sports residency program that I understand is going to help you toward your sport certification, which is a national board exam. When do you take that?
In March.
In March, so that's coming up. We're excited about that, and I think there's value to our patients, there's value to the sport community in Missoula, and we're just looking forward to see how your understanding of overhand athletes can make that big of an impact.
Me too.
Kerri, thanks for joining us, and if you'll stay tuned, we'll have a tip of the day.
The tip of the day. So today we talked a lot about dynamic stability. So today I'm going to show you an exercise how to gain this. It's called a prone ball drop. So the patient or client is going to lie on their stomach with their arm extended out over the edge of the table. They'll be holding a small ball, and it doesn't have to be weighted. It could be a tennis ball or maybe something a little bigger. And they're going to work on quick drops of the ball, working on that dynamic stability and stabilizing that shoulder in space.
I'd like to say thanks again to Kerri Houck for joining us and sharing with us all about the upper chain. For more information on this topic and others, be sure to visit the sports performance page on our website, alpineptmissoula.com.